as a physician practicing in Baltimore, Maryland, where I take care of uninsured people, to be able to come to Canada and see no uninsured people was a complete revelation.
It is hard for physicians who have only practiced in the U.S. to imagine a system that is so simple.
There's a major myth that in a single payer system, you're not going to have the same level of technology and innovation that we see in a for-profit system like we have in the US. And that was totally not borne out by what I saw in the hospitals in Toronto.
People believe in Canada there is less innovation because they think there is less incentive for physicians to be creative in their approach to care. Nothing could be further from the truth.
They had state-of-the-art, incredibly advanced technology deployed by very highly trained and skilled health professionals, many of whom had actually been trained and practiced in the US and specifically moved to Canada or returned to Canada to practice in the Canadian healthcare system because it was a single-payer system.
There's this underlying foundation, this sense of solidarity among the Canadian people that they would not allow their neighbor to lose their house because of medical bills, because of being diagnosed with a disease that they didn't want or ask for.
In Canada, patients need only worry about taking care of themselves. Patients don't ever have to worry about how they will pay for the care they need or how they will get access to the care they need.
The Canadians spend about half of what we spend in the US per capita on patient care.
In Canada, you don't have to worry about a patient's insurance status before deciding what treatment options you can offer them.
When people are able to get the care that they need and not have to worry about being stuck with medical bills, that there's this liberation, this freedom, and they can have a sense of peace about being able to be with their families, do the things that they want to do, without having to worry that they're one step away from bankruptcy.
We heard from Canadian patients that they didn't have to worry, they didn't have stress about whether or not they would be able to pay for the care they need. That is something that is markedly in contrast with what I hear from my patients here in the US. I just would encourage Americans to consider that we can do what the Canadians do. We can have healthcare delivered effectively with very high quality at lower costs.
I love how proud Canadian physicians and patients are of the care they have. They fiercely defend Canadian Medicare. They know this is something they do better than we do in the United States.
So we can have a great healthcare system. We can retain all our wonderful technology and innovation and have a system that prioritizes people's health and wellness, not the profits of big pharma or the insurance industry.
That's what Medicare for All could do for us and our patients.
Our good neighbors to the north have a lot to teach us about how we can improve our system and cover everybody.
There is much we can learn from what they have done.